Okay, I think we'll make a start as people are still coming in. So welcome. I'd like to begin with an acknowledgement of country, and then we'll do some introductions. So please feel free to pop in the chat the country that you're joining us today from. So QCOS acknowledges the historical injustice of colonisation and dispossession of First Nations peoples and its ongoing impact and legacies. We are committed to reconciliation, self-determination, and opportunity for First Nations peoples as integral steps in achieving equality, opportunity, and well-being for all Queenslanders. I'm joining you from Meanjin or Brisbane and respectfully acknowledge the Yuggera and Turrbal peoples and all First Nations colleagues and friends joining us today. So just in terms of the agenda today, we'll be joined by guest speakers. As I mentioned, I'll talk about our guest speakers shortly for the topic of juggling regulatory frameworks. I'll also, that will take up quite a bit of today's session. We'll also share some training and upcoming resources for your information and discuss the next QCN gathering in September. So in today's session, I'd like to welcome everyone again because I know some people have just joined. We have 4 guest speakers to talk about regulation and juggling regulation and frameworks, etc. So we'll be discussing navigating the complexity of managing audits, evidence and compliance requirements, sometimes for multiple regulatory frameworks and sometimes requirements that don't neatly or easily fit or align together. So we're fortunate to have 3 guest speakers on this particular topic to share their expertise and wisdom and explore strategies and offer practical solutions to some of these challenges. And I would like to express my gratitude for each of them giving their time and being here with us today, and we'll introduce you to them in a moment. I'd also like to acknowledge we have another guest speaker, 2 guest speakers who will provide an update for us on the upcoming changes to the Blue Card system. So that's Daniel Shalero and Crystal Lau. So we'll hear from both of those speakers later. So we have with us today, and many of you may already know them, Fiona Lachlan, who is the Chief Executive Officer of IHCA, the Quality Standards Institute. We have Lisa Esaias, Human Services Program Manager from HDAA, and we also have Angela Burden here, who is the Manager of the Human Services Quality Framework Operations Commissioning from the Department of Family, Seniors, Disability Services and Child Safety. So we are first I'm going to stop sharing and we're going to first hear from Fiona. But what I would like to encourage is for you to be engaging in the session because each of the speakers want to hear from you and the kinds of issues and challenges that you're experiencing. They'll be able to monitor the chat or I'll bring up your questions in the chat. So please put your comments and your questions in the chat. It's a great opportunity to have these people with us today. So I'll stop sharing now and welcome you, Fiona.
Thank you, Lisa, and it's great to be here today. Hello, everyone. Some of you I know, some of you I haven't yet met. I am going to talk to you this morning or this afternoon about how juggling multiple regulatory frameworks or compliance from a quality perspective. And it's really a how-to, where to start. What we are seeing now, we work across 13 different quality standards in a couple of different industry sectors. We're actually seeing much more willingness on the part of regulators or some regulators to recognise the alignment of human services quality standards. This is a real step forward, I think, from an organisational perspective. Regulators are becoming more conscious about the impact of organisations needing to demonstrate how they conform with multiple standards. So that means that we can, in some cases, combine audits, or in other states, recognise the contribution that has already been demonstrated. So that is a really positive thing to, it's starting. It's not where it probably could be yet, but it's on the right track. So when I was thinking, how would I advise an organisation who has been used to dealing with one quality standard and they need to take on another one or two to meet their funding contract obligations, where would you start? And in our view, there's probably 3 key areas that you would look at focusing in on. The first one for me is mapping. The second one is capability. And the third one is culture. So I'll go through each of those in a little bit of detail. So in respect of mapping, you want to understand what are the relevant frameworks or quality standards that influence you now. What is it that you need to be aware of? If you can go through a process of mapping the commonalities and map the gaps. Now, there's a few ways that you can do this. You can do it manually, and it's a process that is not for everyone, can I say. We have some people who really thrive on mapping quality standards, and others will never touch it in their lifetime. So you can do it manually. There are some systems or tools out there already developed that will do it for you. Or you can engage a consultant to do it for you. I think they're probably the 3 options. The outcome of your mapping process will be you'll have clarity around where the commonalities are. Your next step beyond that is to look at what are you already doing to meet these commonalities and map your existing activities across those commonalities. It will be things like your risk and incident management, how you're doing staff training, your strategic and operational planning, things like worker clearances and mandatory document obligations. Those kind of things for me are going to be consistent across all standards, but there's a lot more. Once you've got that, identify what your gaps are. Can these gaps be aligned across standards, or are they standalone things that you're going to need to put some specific focus into developing to ensure that you're meeting requirements? So, yeah, there's lots of options to achieve the mapping outcome, but unless you take that first step, you could be not optimising the use of your time or resources in doing that. The next step or function for me is really capability. It's really key. So when I talk capability, I'm thinking people and I'm thinking systems, processes and tools. So what resources have you got to support you in demonstrating how you meet these multiple regulatory requirements? What systems and tools have you got? Do you need to invest in software to support you? Have you got automations in place? Is there someone that you can call on to help you with automations? There's going to be multiple governance, risk and compliance software tools available out there. If you do a Google search on that, there are just so many that come up. Make sure that you get one. If you're going down that route, make sure that you get one that is fit for purpose for the standards that you need it to be. These tools can help you to automate tasks, centralise and simplify your reporting, but again, they're not for everyone, and they come in all shapes and sizes. Probably the most critical area is what people have you got? Who's responsible for coordinating your quality management, and what resources do they need? Do they undertake this role in addition to their regular work, or is this the key focus of their role? What support do they need? What training do they need? You know, do you need to send them on a basic quality management training course, or do they need internal audit? Have they got a lot of experience and we need to give them specifics in these quality standards? Support them as much as you can to ensure they've got all of the tools that they need to do the job that they need. The other thing I'd be looking at from a capability perspective is how are audits against quality standards viewed within your organisation? Are they seen as an event that must be endured, which I call event-driven quality, or are audits seen as the opportunity for an independent set of eyes on what you do to help you deliver safer, higher quality services? The other question I'm asking, is quality integrated into your daily operations, or again, are you coming from the event-driven perspective and you think about when your audit's 3 months, 6 months out? Have you got a responsibility for quality included in your employee position descriptions? The next phase I'd like to talk about is how to develop a culture of continual improvement, because this is going to really support you in meeting obligations under multiple frameworks. So what's your organisation's approach to communication about quality? Do all employees understand the organisation's obligations and why you're doing this? Do employees understand what's required in their roles from a quality perspective? Are your employees comfortable in raising concerns, raising risks, raising opportunities, and reporting incidents? What role does your governing body play in supporting the organisation to continually improve? Does your governing body have any lived experience, either on the board or in providing advice into the board? This, I think, is something that you're going to see more requirements on into the future. How is advice that comes through lived experience, consumer feedback, worker feedback, how is that incorporated into your organisational policies and procedures? Can employees talk about that when they're questioned about that? Do you conduct regular internal audits? What do you do with them? Are all of your employees involved in the internal audit process, or is it only the quality team? When you go through these processes, how do you measure improvement? How do you know that you're getting it right? Are you ticking this action off the list, or have you got more quantifiable boundaries around that? And really importantly, how do you celebrate your achievements from a quality management perspective? And is that communicated? Final thought that I would leave you with is, if you're trying to meet the requirements under multiple quality frameworks or standards, is look to find out, first of all, is it possible to have combined audits? So you would be checking with your funding bodies about that, but also the certification body that you engage to conduct your audit. So thank you.
Thank you so much, Fiona. Do we have any questions for Fiona? I'm happy for people to pop them in the chat, or if you'd like to pop your hand up and come off mute, we're happy for that to happen too. Otherwise, we can save them till a bit later. Haven't seen any questions at this stage in the... Oh, okay, so we've got a question from Marie. When trying to research quality management training courses, programs, found what's on offer where to be very confusing in finding tailored fit for purpose recognised program. Can you recommend?
You're absolutely right. There is so much out there. Yes, I probably could suggest a few options, but I would like to do my research before I actually do that. Can we come back to that at the end? Is that okay?
Sure.
Yeah, I've got a few in my head, but I just want to check that out. So, yeah.
Okay, yep. Thank you, Marie. All right, we might move to Lisa if we can. So we'll welcome Lisa from HDAA.
Lovely. Thank you, Lisa. And good afternoon, everybody. Thank you for the opportunity to be part of this meeting today. I'm just going to share my screen because I've got a couple of slides to keep me on track. So just bear with me. Everyone can see that, hopefully. Yes. I can't see anyone, so if there are any questions or anything, please do let me know. I was going to focus more on the certification alignment and things to consider, benefits, etc., to aligning your certifications. I think, like Fiona said, there definitely are more possibilities than maybe there were in the past in terms of aligning your certifications, different certifications, if you do have, I guess, a suite of different standards that you need to meet. So probably the first thing that I would say is, if you do have multiple standards and you haven't already, do have a chat with your certification body around how you can possibly align those and look at when things expire, whether midterm audits are required, etc. And what are your options and what you can do. So definitely, first of all, have a look at that if you haven't already. But some considerations. So first of all, certification cycle and timeframes. So these sometimes can be quite different across different standards that you may need to meet. But again, have a chat with your certification body, have a look at what the requirements are, who are the different regulators. Occasionally there might be some wriggle room with maybe moving a maintenance or a midterm assessment out by a month to align with another standard. And I think possibly Angela will talk a little bit more about that from a HSQF perspective. But there definitely are more, definitely see more changes and more opportunities to enable that to happen. So definitely worth looking into. Also specific scheme requirements, so they're to be considered. So there are certain schemes that don't allow standards to have their audits conducted at the same time, such as the NSQ HSS as an example. So that's also another consideration, and also your certification body would be aware of where there may be situations where it's not possible. The organisational structure is another thing to look at. So again, if you're working across different standards, you might have different programs and therefore different staff working in different areas. So you might, for example, have child safety within HSQF and you've got staff in that area. You may also do NDIS and have separate staffing. So there might be some crossover sometimes across different programs, and obviously then that will work really well if you're looking to align certifications and have audits at the same time. Where they are quite different, I guess you just need to consider, are there obstacles, or is there a way, again, working with your certification body, that that could still work to have their audits at the same time. Also, you're around the organisational policies and procedures. And I guess if you're looking at updates to these as well, be thinking about, if you are looking at aligning standards and having your audits at a similar time, where possible, and it's not always depending on what that policy may be around, but trying to make them a little bit more generic so that they can go across different standards. So if it's very specific and the policy might mention NDIS throughout, but you're also wanting to use it for something within HSQF, obviously that might be a little bit of an issue if there's all those references to NDIS. So again, just sort of looking at where possible, is there ways to make some of those things a bit more generic so it goes across a larger area of your business or programs. Another consideration there is around reporting requirements. So depending on whether there is a regulator for the specific standard, there might be specific reporting requirements on you, but also on your certification body. So again, that will depend on what that standard might be. But certainly, again, if you're aligning the standards, the audits are happening at the same time, your certification body will be able to separate any of that reporting to ensure that reporting, for example, just for NDIS goes to NDIS, and anything that's maybe just specific to HSQF as another example is just going to the HSQF team. So that's definitely something that certification bodies are able to do and do take into account when they're aligning your certifications and having audits completed at the same time. Other things to consider are where there's an opportunity for different assessment methodologies. So by that I mean there might be requirements to have on-site audits, and quite often that is stipulated in different scheme documents that you do need to have an on-site audit unless there's prior approval from a regulator or extenuating circumstances. But there could be an option to sort of look at a hybrid approach occasionally where you might have some things done remotely via Teams or Zoom, and other areas that do need to occur on site. So again, that's another thing you can talk about with your certification body to see whether that's an opportunity. And then just links between standards. So quite often there are quite a few links between standards. So for example, for HSQF and NDIS, there's some links within HR areas, governance and management and risk. May not be everything within the standard, but there would be components. So when an assessment plan or audit plan is put together by the certification body and their auditors, they can take that into account. So rather than having multiple meetings, say for governance and management, there could be just the one meeting, and the auditor will put that plan together for that meeting in a way that they will cover off each of the standards that are being covered at the audit. So that way you're not having multiple similar meetings across the different standards throughout that audit plan. So you've got less duplication happening there. Obvious benefits, cost and time efficiency. So if you're having to have 2 or 3 audits a year or over a couple of year time frame, obviously if you can combine that into the one audit, you are going to get that time back, and that obviously will affect the cost as well, hopefully reduce the cost if you're able to combine those audits. Also means obviously you're not having to take away your staff from what they're doing best and working with your clients for all of these multiple audits occurring at different times. So there's definitely the benefit there if that's possible. Well, I was also going to mention there just about site sampling actually. So sometimes there might be where you've got multiple standards across a particular site. It may be possible to ensure that that site is included during the audit to ensure that you're covering off all the requirements at that particular site. So again, reducing the number of sites possibly to be visited, depending again on scheme requirements, because we still need to meet those. But often choosing some sites that maybe cover a multiple range of standards within a cycle. again, within scheme requirements where we can do that. Cycle alignments, like I just mentioned before, if you've got less audits, you're still focusing on your continual improvement, but it just means that you're not having to take that time out multiple times throughout a year or 2-3 year period where you're having to have audits where quite often you're covering similar things but across different standards. And also increasing staff understanding of requirements. So if you're looking at having an audit across different standards, so you might have some staff that don't necessarily work so much maybe in the NDIS space or the HSQF space, but by bringing those audits together, it's going to increase their knowledge within those areas as well, and obviously help with continual improvement. Although I guess the aim is to, where possible, have cycles aligned and have audits being done at similar times, there are some times when it doesn't always work well, just from our experience. Obviously, sometimes things might align for one assessment, but not for the next, and that's going to depend on the scheme and how many audits are required. In generally, it's a three-year certification cycle. Those that work within the NDIS space know that the audits for midterms are governed by when the registration is approved by the NDIS Commission. So it's not always clear when that midterm is going to be until we know when that registration is approved. So it can be a little bit difficult to then try to work out, is that going to align with my next HSQF assessment or not? But obviously, where possible, it obviously will work and it will work well, but that can be a little bit of a barrier at times. Occasionally, we have found from a certification body perspective, it can get a little bit tricky if there are different main contact people across different standards, and therefore sampling, etc., and getting things back might be coming in from different people within the organisation, and may not always talk to each other about, what's happening with the other component of the audit that's happening. So it's not a problem, but what we've probably encouraged going forward, where there might be multiple main contacts for an audit from an organisation, is just to make sure, maybe there's some Teams meetings and things that we all get together, the CB as well as the those main contacts, just to talk through the process and make sure that we're all working on the same page. So it's definitely doable, but that's just something to consider. And yeah, that sort of goes into the next point there around where you've got different staff across programs and combining assessments. It does sometimes create confusion. Having said that, it's still, I think, a benefit having different staff across programs working on an audit together, because it just gives them extra knowledge in those other program areas. And I think, yeah, it's just a good opportunity to be able to do that where we can. So they're little barriers, but I think as more and more organisations do combine audits, it definitely becomes less of a problem. And that is it. That was it from me. I don't know if anybody's got any questions. I couldn't see the chat.
No, we haven't had any questions in the chat for you yet, Lisa, but thank you so much for your presentation. Does anybody have any questions for Lisa? And you've got opportunity for the rest of the session to ask them, but happy for you to pop your hand up and come off mute, or pop a question in the chat. If not, we'll leave it for now, and thank you again, Lisa. And we will welcome Fiona Burden from the HSQF team to present. So I'll be popping your presentation up, Angela. So hopefully. Okay. So you can see that?
Yep.
Welcome, Angela. And I'm not sure if you saw in the chat, there was a question popped in there for you. Would you like me to read that out?
Yeah.
Yep, okay. So Diane has said that she'd be interested in hearing from you about the time frame for including the Child Safe Organisation standards in the HSQF audit process. So you might cover that as part of what you're talking about. We've got a question there for Wendy, but that's not specifically for you. So I'll let you commence. Thank you.
All right. Well, good afternoon, everyone. Thank you so much for your time. Really appreciate it. I know everyone's incredibly busy at the moment. Also want to thank Lisa and Fiona for their thoughts. Obviously, incredibly important and really insightful. And there's not much I can add to that, all really good information. I'm just really going to talk quickly about the Human Services Quality Framework and what we are, what we aren't, and how we're looking at governance and focus a little bit on into the future and really around our reform work. So the Human Services Quality Framework is a set of standards and a guidance framework. It's not a regulatory framework. So the Queensland Government uses this framework to monitor and understand, assess and promote and improve the quality of the provision of human services within the state. Talking predominantly about another area of HSQF that does differ somewhat from many of the other standards that are around, and that is that we're a closed scheme. So a lot of other or regulatory standards are something that you can actually jump right into. So for example, NDIS, you can decide to become an NDIS provider, but the way that the Human Services Quality Framework has been designed is really around the funding that the Queensland Government has provided. So what are they providing the funding for, and what are the parameters around that? So without those parameters, it's hard to assess. So that's why they call it a closed framework. And we know that organisations have asked on a lot of occasions to become HSQF certified, but that has often been problematic without the correct funding around the organisation. So the funding actually applies to the organisations listed on the screen, or the types of organisations. So realistically, it has a lot to do with what is in your service agreement and your specifications. So we can go to the next slide. So this is really just talking about why we're using the standards. And you know, we look at standards like HSQF to provide a kind of a benchmark for assessing quality of service delivery. Generally speaking, standards are used to, I guess, monitor the internal workings of organisations, which create standardised levels of safety. Our standards, in particular the HSQF standards for Queensland, really define the systems the government requires organisations to have in place for efficient service delivery. The government uses these standards as a kind of these expectations for safeguarding vulnerable Queenslanders and minimise our exposure to risk in providing confidence to the government, to service users, and also to the Queensland population. The next slide should be no unusual slide there. I hope that's a really familiar slide. I hope everyone sort of had a really good understanding of that. Realistically, HSQF is around 6 standards. We have a really broad range of service streams or service applications that utilize the HSQF. So the standards really have to, by necessity, cover off on a broad range of activities. So that's why they're written in that kind of that broad range or capacity. So now the next slide, really talking about Queensland Government and what do we see as some operational opportunities. And I think both Fiona and Lisa spoke to it, and within HSQF there is an understanding, and certainly the departments or the areas that HSQF support, there is an understanding that the organisations who utilise HSQF are subjected to a lot of regulatory compliance and a lot of other standards, in some cases many other different ways of complying. So there are opportunities there for alignment, and under certain circumstances, and again with HSQF the complexity does lie in which stream organisations are in, but the opportunities that we look for are really around if there is another accreditation piece or certification piece that is quite heavily aligned with HSQF, there can be some opportunities there to recognise the other entire accreditation or parts of it. So certainly we are always looking for that. And one of the more important aspects that we look at is really that harmonisation with other accreditation areas. Also really looking at integration, so governance as integrated with practice. So, many of the organisations who work through HSQF know that HSQF is really designed to be a part of the practice that they offer. So it's looking at systems integration, looking at staff integration or the integration of training within practice, and trying to use those layers as one single piece. And I think Fiona and Lisa really spoke to that in terms of how you can do that through systems and understanding that mapping opportunity. But what we're really looking at the moment is into the future, and we've got a reform piece that's been happening. So if you could move to the next slide. Our reform piece is a really large part of what we're looking at. And in that reform piece, we're looking at shifting the focus. So the focus has been or is in the current form or iteration of HSQF, the focus is really with the standards around how does that look through an organisation. But we are sort of seeking to embrace some of the contemporary methodology of frameworks and quality, essentially, in that we're looking at a service user focus. And again, that's another opportunity where we've harmonised with other accreditation and certification bodies. So we are looking at how you can really have our new or the new reframed or reformed service, the new reformed model, looking at it from differently, definitely a cultural shift, and looking at these service users and how they can how they receive the services. So this does fit within the human services and certainly the National Human Services Framework and the new intention behind quality frameworks. So our reformed model really looking at putting service users in the centre of quality management and the assessment process. And it, obviously the alignment with the Royal Commission, and we're hoping that within that quality pathway, we, by doing this, we are creating those efficiencies. But just on the reform, we've got a set of standards that was developed about 14 years ago. So we are really contemporising where we're looking at, and this is one of the ways that we are creating some standardisation and some streamlining for the NGOs that work with us. Importantly, and my colleagues in the reform have asked me to let everyone know that we are looking at consultation very soon. We're requesting expressions of interest for NGOs to participate in reviewing drafts. It's a very simple survey that is coming out around October, so quite shortly, and communication will be sent out very soon under the HSQF certification and through QCOS as well. So if you are interested in becoming part of that consultation network, we know that NGOs in particular are in very busy environments, but being part of the consultation area of the reform is really important, so that we actually do hear your voice in this reform. And we know that we have a working group, and it is QCOS have been really brilliantly representing certainly the sector. But it would be really important to hear your voice. So we've got there on the contact details, the reform, HSQF reform at dcssds.queensland.qld.gov.au. And if anyone is interested, if they could please just let us know, and we can certainly add you to our list. But it is an opportunity for organisations to get involved. And at the moment, I think one of the layers of involvement would be reviewing the draft new standards and providing feedback to those. So this is a real opportunity to be part of some work that can really assist organisations into the future in working with these quality standards. And we're just very, very interested to hear any of the real points that you want to get across to the Queensland Government around challenges that you might be facing, but also, areas that you think are really, really important within quality standards. And that's me. I just really love to hear from everyone around, what they find incredibly helpful and always what they find challenging, and anywhere where we can assist and support.
Thank you so much, Angela. There are a couple of questions that have come through for you. So one of them is, do you have any recommendations in training new leaders that may not have worked within the human services area to understand the HSQF, and then in return to prepare for the auditing that takes place alongside it?
I do. QCOS have some fabulous training that is specifically focused on HSQF. QCOS are partners with us, so their training, and I took it on board when I first arrived at HSQF from the sector, and look, it's really comprehensive, and it is really, really helpful. They have a lot of resources on their page as well, and I think there are some resources on our page as well that help us go through. But our user guide is a great read. If you don't have a novel at the moment, just take it in, tuck yourself in bed and have a good read. It's fantastic, and it'll take you through everything you need to know. And someone did ask about the child safe standards. So I'll just quickly tell you that, you know, our job has been to look at the child safe standards and to incorporate them into the HSQF. So one of the really good things that they have done with the child safe standards is to, you know, not have them as its own regulatory body and impose more and more and more, you know, difficulty on people, but it is a legislation, and it is another thing, but we have incorporated it into our existing models. So if you do have an audit and you are in scope of the child safe standards, and it is post October 1st if you're in that first lot, or January 1st if you're in the second lot, or I think it's April 2026 first if you're in the third group of people, it will be incorporated into the audit. You know, our auditors are an incredibly experienced group of people who take into account context whenever they audit something. We understand that it is an organisation's obligation to adhere to legislation. But, you know, within that context, an auditor is able to understand where an organisation sits, and they also we've got a training session coming up very shortly with the people who audit through HSQF and the QFCC. So the auditors will have a really good understanding of what the QFCC are talking about and are expecting as well. So whilst it is an organisation's obligation to adhere to legislation, the QFCC do have an understanding of, you know, the complexities of what not-for-profits do work with on a regular basis in terms of compliance. And so do our auditors. And our auditors, you know, a fabulous group of people who really work with organisations to work through these complexities. So I think, you know, what's published on our website at the moment in the user guide is a very detailed description of what we will be using as evidence that an organisation is working within the legislation.
Thank you, Angela. There's another comment or question here. So thank you, Kelly. There are almost 200 key action areas and indicators in the NPCSO. So I'm wondering how assessing these will be integrated into HSQF audits.
NPCSOs is
so
the
community
child
service.
safe.
Yeah, child safe organisations.
Child safe organisations.
Yep.
So the user guide, the HSQF user guide, outlines very specifically. So, you know, I think it's understanding how to become a child safe organisation or child safe entity. That is the realm of the QFCC. So they are very clear. They have, you know, all of their guidelines and all of that. What we have done is we have our user guide. It is published and it provides a very clear guideline around the evidence that we will be seeking through the certification process. So they're two very, very different things. How you become a child safe entity is you know, one area and one undertaking. What HSQF might be seeking in terms of the evidence that we will be looking for as guidance throughout an audit process can be found in its Standard 1, Indicator 1.1, and its Appendix D in our user guide. and it details it very clearly, the evidence we will be seeking, and you know what sort of guidance an auditor can be looking for in order for them to comfortably determine whether or not your organisation is working within the legislation.
Thank you, Angela. I'm conscious of time here, so we're at 12:50 and we definitely need to hear from Dan and Crystal. So we'll move over to Dan and Crystal, but thank you again and keep your questions coming through. We can also follow up after the session. Thanks. So would you like to share now, Dan or Crystal, whoever's sharing?
Just setting it up now. Hi, everyone. Thank you for having us. So I think I'm seeing some familiar faces. I'm not too sure, to be honest, but the user guide sounds familiar, Angela, that you were talking about. I think I've looked at that a few times. Okay, so Lisa, thank you for having us. So my name's Dan. I work at Blue Card Services. I'm part of the community information team, and I work with Crystal. So today we're just going to provide a little high-level showcase of the upcoming change to the Blue Card system. So yeah, let's kick on. So as you're aware, all children in Queensland have a right to be safe and protected from harm. So Blue Card Services plays an important role in helping keep kids safe. And like I said earlier, we're covering the changes. So the Blue Card system is regulated by two pieces of legislation. So on the screen, you can see the Working with Children Risk Management Screening Act 2000 and the Working with Children Risk Management Screening Regulation. Now within the Act, there's 16 categories of regulated employment and 12 categories of regulating business. So in order for someone to need a Blue Card, they need to fit into one of those categories. So when we basically refer, when we say employment, we refer to paid employment, volunteer work, and business. So it captures everyone. So just take note of what you can see there, because I will show you a comparison slide to see what is actually changing. So the Blue Card system can seem complex. So we break it into 4 stages to explain it. Blue Card services, individuals and organisations work together through these stages, with each playing an essential role in keeping kids safe. The 4 stages are: first, we identify who needs a Blue Card. We consider the type of work and the work environments where individuals are required by law to hold a Blue Card. And this is explained under the Act within various categories. Then we start the Blue Card check, and we look at police history and other information to determine whether a person is eligible to work with children. We monitor cardholders and applicants to ensure they remain eligible to work with children. And finally, organisations must manage their mandatory obligations to ensure they are compliant with the Blue Card system. Essentially, the identify and manage stages are the organisation's role, and the check and monitor are our role. So now let's just have a brief overview of the legislation changes. So in September 2024, a new piece of legislation was passed to further strengthen and streamline the Blue Card system to align with other states and territories. These changes are being implemented in a phased approach. The first few changes happened on 1 July, but most of the changes will come into effect from 20 September this year. So we'll highlight the changes at a high level as they fit into the identify, check, monitor, and manage stages. And this is just a quick summary, and you can find more information about this on our website. So in the identify stage, we have expanded the reach of the Blue Card system by adding 3 new categories. And these are the justice and detention services, education services and activities conducted inside of school, and the entertainment, beauty and photography category. The expanding existing categories to capture more employment types. improved other categories to make it clearer on who needs a blue card with specific examples, changing the volunteer parent exemption and how it can be applied. And if you are familiar with that exemption within your personal life, you may have noticed that in some situations you could rely on the exemption, but in some other scenarios you couldn't rely on it. It may interest you that with all these changes that are coming, we estimate around 40,000 additional people will need to apply for a blue card within the next 12 months. So it's getting kind of crazy. Okay, so here's the comparison slide. So if I'll bounce back here. So this is current, what you can see now. And if I jump forward, you'll see the changes. So the new categories have been added here. Some have been amended, and the ones that have been added have been marked with a green tick as well. So you'll see that we've got justice and detention services, we've got child accommodation services, which has been amended. So it's just taking the including homestays out of the heading, but it still includes it. You've got the sport and active recreation gyms and play facilities. Now to clarify, this kind of work was already captured under the blue card system. It's just now being called out. We've also got the new category, entertainment, beauty and photography services. So an example on this would be, a common scenario would be, your Santa Claus at your shopping centre. Previously wouldn't need a blue card, but now does. What else have we got? So for the 15 categories of regulated business, you'll see education services and activities conducted inside a school. So currently, under the current legislation, it was hard to capture a business operator going into a school because they wouldn't fit an employment category. But now with the introduction of this category, it actually allows a lot of contractors who are providing services to children within the school setting to actually be captured under this category. So we'll talk about the changes to the check stage. So these changes are mostly behind the scenes and reflect internal changes that most people will never see, but are no less important. So the new decision-making framework. This changes the decision-making test from in the best interest of children to be more specific and look at risk to the safety of children. It will also factor in a reasonable test, which will require blue card services to consider if a reasonable person would allow their child to have direct contact with the applicant without supervision while engaging in child-related work. It also simplifies the disqualification framework. New legislation simplifies the disqualification framework by reducing the complexity of the application process. Put simply, if a person has a history of certain convictions, their application can be rejected quickly with no alternate pathway to apply. There's a new suspension power. So the new power will allow blue card services to suspend a blue card if we receive information that leads us to suspect that if the person was to continue working with children, they may pose a risk to the safety of children. This builds on our current suspension powers, making the system stronger. The new power to cancel a working with children check authority for lost contact. So if Blue Card Services receives police or other information about a card holder, we may need to contact the person. If we are unable to contact them because perhaps they have not kept their contact details up to date, their card may be cancelled. The decision maker can access specialist knowledge, skills, or experience. So when required, Blue Card Services can appoint an individual or advisory committee with specialist knowledge or experience to assist with the decision-making process. This can enable cultural, geographic, socioeconomic, or other relevant contexts to be considered in the assessment process. We can also leverage expertise in child protection, domestic and family violence, mental health, social work, or drug and alcohol abuse to inform the decision-making process. So there are no changes to the monitor stage, so I'll jump straight to the manage. As I mentioned earlier, organisations have obligations that they must comply to, and there are some minor changes to what details must be contained in their employee register. And there is also major changes coming to the child and youth management strategies and how it's regulated, which was kind of just discussed earlier, so we won't go into that any further. A couple of other changes that don't fit into our little diagram are the introduction of new self-disclosure requirements. Applicants will be asked on the application form to disclose about their disclosable matters. These include information relating to child protection history and domestic violence orders, both here in Queensland or elsewhere. A penalty may apply for failure to disclose information that has been requested. Our compliance team are gaining a new power to compel information, but what does this mean? Oops. So Blue Card Service will now be able to compel information or documents from individuals or organisations to assist in auditing or monitoring compliance within the Act. This information may be then included in the referral to the Queensland Police Service, which could end up in court. So if an organisation fails to provide this information by the requested due date, the organisation could be fined up to $8,345. So we do have a neat little website that has a lot more information on it. Please feel free to visit that site if you can. I thought I had a URL at the top there, obviously not visible, but I'll pop it in the chat if you can't see that there. And if you'd like any more information, we do host, thank you, Crystal, we do host regular information sessions online and in person. And you can click that online session button on your screen there. That'll just take you direct to our website.
Just want to add, Dan, so the upcoming session is coming up. It's actually next week. So we have 2 online sections which is available. If anyone would like to learn more about the changes and how it will impact you, particularly, we're transitioning, our risk management strategy from Blue Card Services to QFCC from 1st of October, you're more welcome just to, spread the words and sign up for one of our online sessions. Thank you, everyone.
Thank you so much.
I can just see a question there. The processing delays would only impact on the individual, so depending on their background history. So that's basically what it sits on. It's case by case, person by person.
Thank you, Laurie, for the question. All right, so we've just past 1 p.m, so I'd quickly like to thank all of the speakers today, all of our guests, so Fiona, Lisa, Angela, Dan and Crystal. If you have further questions for any of the speakers, please send them through to Kikos or to myself, and I'll reach out to them to see whether we can and then provide it back in the QCN chat. So thank you once again to all of our speakers for joining us today. Thank you out there for participating in today's session, and we look forward to seeing you next time.